Welcome back to the Humble Healer podcast. And today, thank you for joining me, Dr. Quang Lei. I'm a family physician, and I talk about a variety of different wellness topics. And thank you for joining me. So today, I will be talking about a topic that affects many patients that I have seen in the urgent care setting and primary care setting. Those afflicted with asthma, environmental allergies, and also in a lot of cases eczema. And one thing that we should know is that there is a close link among these three conditions, which means that if you have history of asthma, you're more likely to have allergy problems as well as eczema. So also controlling allergies or allergen exposure also affect not only allergy symptoms but asthma symptoms, since a lot of things that we inhale can cause allergy symptoms such as sneezing, runny nose, stuffy nose, cough, but it also can cause wheezing and shortness of breath and chest tightness and contribute to uncontrolled asthma or asthma exacerbation or flare-up. So they all work together, and there is a medication such as Singulair, on the generic name is Montelukast, that actually is an allergy medicine. So in this case, I am not talking about medications, but I'm talking about environmental control, things that in your household that you can help control in order to reduce allergy and asthmatic symptoms and maybe even eczema. What do you look for? And I was inspired to talk about this topic because of a case that I saw a few days ago by a savvy patient that I saw a few times at the urgent care clinic. And apparently this patient I saw a few times for COPD, which is chronic obstructive pulmonary disease, form of smoker's asthma, because of uncontrolled wheezing and tightness and chest tightness and shortness of breath and cough. And this happened just a week or two after she moved into a new apartment. And I gave her steroid treatment, antibiotics, inhalers, and cough medicine, and so on, the usual treatment for COPD flare-ups. And so I discharged her from the treatment, but she came back a couple of weeks later and she said that she found a cause or reason for her COPD flare-up. And she showed me, and it's pretty impressive. Apparently, she looked up when she moved into the new apartment. It looks clean, but she said that it smelled very wet, like a wet sock. So she had to turn the fan on, aiming at the corners where it had the strongest wet odor. And then what she did next, follow the instructions. So what she did was she left these dishes open for 1 hour only, where she suspected there could be mold, and then she closed the lid, and then she put them in a dark, cold corner of the apartment and left them there for 48 hours. And then she showed me what grew out of it, and it was really impressive. And so I will upload the pictures for you to see. She still had to go back there to move all the stuff back out. And she notified the landlord, and they promised her they would clean it up for the next tenant. So it's, and you learn something every day from patients, and that was a very good lesson for me to help my future patient to control asthma and COPD and allergy. And that's a simple test that you can get, and you can have visible evidence also. Sometimes that provides a very great visible evidence for anyone that want to see whether they have mold in their apartment. To get started with environmental and allergy assessment, we should look at both the home and workplace and evaluate for dust mites and pest, mold, and indoor indoor pollutants. Confirm sensitization with skin prick testing or allergen-specific immunoglobulin E, IgE. And that's something healthcare professionals can do. And then once that's confirmed, you can implement targeted mitigation of those allergens. So for dust mites, can come from impermeable mattresses and pillow encasement with weekly hot water laundering of bedding, and air purifier. Vacuuming encasement alone are insufficient, and they must be part of a multi-component treatment. So dust mite can be a tough problem, and also managing them can also be challenging with those weekly laundering. It's not easy. Dehumidifier And then the next one is cockroaches and rodents with integrated pest management using professional extermination and sealing entry points and removing food and water sources with thorough cleaning is recommended as a standalone or combined strategy. And this has strongest evidence among the single intervention for asthma improvement. Like I said, was smoker's asthma. And then pet allergens. If people had severe uncontrolled asthma and had pets and had documented pet allergy, then unfortunately removing of the animal is the ideal solution. But if not feasible, keep them out of the bedroom and use the bedroom HEPA air purifiers and wash hands after contacts. And cat and dogs allergens are carried on small particles and remain airborne, making HEPA filtration more useful here than for dust mites. And for mold, we talked about that. And HEPA air purifiers can reduce spore count and maintain low indoor humidity, and also use professional services. And for outdoor seasonal pollen, we keep windows closed during peak season and use air conditioning, shower, and change clothes after outdoor exposure, and monitor local pollen counts. Surgical masks may suffice for pollen more than 10 micrometer, and 95 masks are needed for high when there's air quality is poor with 2.5 part per million pollutants. So non-allergenic trigger avoidance such as tobacco, smoke, vaping, cannabis, biomass fuel, wood burning stoves, gas stove emission, nitric oxide, volatile organic compound, outdoor air pollution, all can cause airway inflammation and should be addressed alongside allergen mitigation. So there's a lot of these things that we can keep an eye on. The smoke from Canada, that doesn't help. So those I have seen patients struggling with that on those few days where it was terrible. For allergen immunotherapy, patient would confirm sensitization and inadequately controlled by avoidance and medication. Then they have allergen-specific immunotherapy. Can be injection or sublingual can be beneficial. In asthma, it should not be used unless the asthma is severe. So, in conclusion, if you have uncontrolled asthma, it's by using daily medications, and it's worthwhile to look into whether you have mold, as I talked about, and also cockroach and rodent pest management, and then look to see whether you're allergic to cat dander or dog dander, and then dust mite too. It could be tough, but basically you can do a risk reduction strategy to help reduce exposure to your allergy and airway system. So I hope you find these helpful in controlling your allergy and asthma, and also maybe helpful with eczema. And let me know if you have any feedback and comment. Please hit the like button and subscribe to the channel. Thank you.